let me go through names really. Let me go through names really quick. Craig, are you here? Davenport?
Yes, I'm here.
Perfect. Okay.
I'm here.
I see that. Okay, perfect. I see that Gail is here.
Correct. My camera is not working for some reason.
Okay. Jill is here. Jill Burkholder's here.
Yes, sorry.
That's okay. Chris Thompson is here.
Present.
Okay. Lita Phillips. Lori Moon. I know Mark Bullock is excused. Dr. Limburger's here. Shane Lindsley is here. Do we have Kat Nichols here? Okay. I know we have Ashley McGee, Jessica Thompson, Justin Johnson. Crystal Kenyon, are you here? Okay. Nancy is here. Tom is here. Savannah is here. I know Katie Cutshaw is here. Jackie is here. Jackie, can you give us your last name?
Sour.
Thank you.
Uh-huh.
And then is there anyone else that I missed when I was going through my list of folks?
This is
Yeah,
Lori
hi there.
Moon.
It's Katarina Rice from the Spokane County.
Perfect. Thank you.
And Kim, this is Josh Henderson here with Spokane County ASO.
Okay, perfect.
And Kim,
Anyone-
this is Lori Moon.
Okay,
Oh,
perfect.
Yeah.
Thank you very much. Okay, so just let me go one more time through. Is Lita here? Or Kat Nichols? Or Crystal Kenyon? Chantel from NAMI? Liz Perez, Robert Lang.
Yeah, I am Crystal Kenyon. I'm the one that is hosting the meeting for you guys.
Okay, thank you. Okay, all right. If folks could take a look, please, at last month's, or excuse me, 2 months ago, the minutes, and see if there are any corrections that are needed. And in the absence of a need for corrections, if someone could provide a motion to approve, and then a second, that would be great.
I motion to approve.
Thank you.
I just need a second.
I second it.
Perfect. Thank you so much. All right, moved and approved. Okay, moving on in our agenda, it looks like Opiate Abatement Council. And I know there was a PowerPoint or presentation sent out last week with the meeting minutes. So if you folks have that, please pull that up, or Jessica, you may actually have that to show us as we're going on here. So we'll turn it over
Yes.
to you.
Thank you, Kim. Crystal, can I share my screen? Wonderful, you're on top of it as always. Let me pull this up. Let's see here. Can everybody see my screen okay? Should be the first
Yes.
PowerPoint. Okay, wonderful. Just going to take another quick minute to introduce myself. My name is Jessica Thompson. I'm an integrated care coordinator and program administrator with the Spokane County Regional BHASO. In addition to that, I'm the facilitator of our Opiate Abatement Council and take in lead in conjunction with our leadership here on some of the opioid settlement funding for Spokane County. So for the sake of time, I'm going to get started. This is an update on the Opioid Abatement Council as well as the opioid settlement fund priorities that we have given to the commissioners, and then it's at their discretion how they use those funds. So we'll get into it. First, an Opioid Abatement Council update. We had our first Opioid Abatement Council meeting held on October 30th of 2023. For those of you that don't know much about the Opioid Abatement Council, we are a body made up of regional participating local governments that include counties within our region, and that's Adams, Ferry, Lincoln, Pend Oreille, Stevens, and Spokane County, as well as municipalities that have over 10,000 people. So that includes Cheney, Liberty Lake, and the city of Spokane, and the city of Spokane Valley. And our role in this group is to come together and we have a couple different things that we do. We create a centralized dashboard so everyone in our region, the public, can know how we are using opioid settlement funds in each of the jurisdictions, as well as just to work together to identify priorities for within each of those participating local governments. So so far, everyone is in different stages. They're in planning stages on how to spend those funds.
Jessica? Yeah, and I want to be clear on this for our BHAB. There's two aspects of the opiate settlement funds. And so everyone's clear, opiate settlement funds were a result of various litigation that occurred between federal and state governments against those that provided opiates to individuals. They settled out of court. Some are still settling. For those funds, they were distributed against cities, counties, and the state. Washington State, there's a 50-50 split between the state of Washington and the municipalities of over 10,000 people. So for cities and counties that have over 10,000 population size, received an allotment based on a measurement of those that have been impacted by opiate use and their total population size. That is Fairview Heights, Cheney, Liberty Lake, Spokane City, Spokane County, Stevens County, Adams County, and Pend Oreille counties within our 6-county Spokane Regional Service Area. Those are how some of the funds poured out. As part of the One Washington MU that distributed those funds, there has to be an opiate abatement council. That is separate and distinct from the opiate dollars given to Spokane County. So when we talk about opiate abatement council, that is an administrative responsibility that Spokane County took upon itself and the other 6 municipalities that exist to be able to distribute the funds. Spokane County will be doing uses of funds separate and distinct from the OAC. So when Jessica talks about OAC and opiate use dollars, settlement funds for Spokane County, they are separate and distinct. OAC has no control over the municipalities or Spokane County, but Spokane County is unique in that we're running both of those. No other municipality is doing that. So I hope that adds a little more clarity to the distinguishing factor between the two. They are not the same, and money from Spokane County does not flow into the OAC. So it's unique and it's somewhat complicated, but overall there's just two different oversight capacities. So Jessica, back to you.
That does
Thanks,
help. Thank
Justin.
you.
Does anyone have any questions about that before we move forward? Again, as Justin said, this first part of the presentation is about the Opioid Abatement Council. And then the second part of the presentation will be more about our Spokane County Opioid Settlement Fund specifically.
Nope, that was my question. Thank you.
Wonderful. So like I was sharing, we had our kickoff meeting for the Opioid Abatement Council on October 30th of 2023. We have representation from the counties and municipalities that I shared with you before. And each participating local government is in different stages of their funding. Some have spent some of the funding that they've received, and others are still in the planning stages. We are also currently talking about how the Spokane County ASO can receive some administrative funding to support our efforts in leading and facilitating that meeting. It's going really well so far. We have representation from all the governments, and we are excited to see how things move forward and how we can work together to use this funding to best serve our region. So before I move on to the Spokane County specific updates for the opioid settlement funds, do we have any questions about the Opioid Abatement Council?
Is that dashboard created yet, or it's in the process of being created?
Yes, so it's in the process of being created. However, we do have a website, and I will drop that link in the chat. I will have that here prepared to go in the chat. So we have a website as part of our role as the facilitator of the OAC is to create a website that is that public. That's where the public can go and see annual expenditure reports. I just shared that with you in the chat. Thus far, none of those expenditure reports are posted, but there's information about the OAC, who is represented, future meetings, agendas, and meeting minutes that are all displayed on the webpage. Any other questions before we move on? All right. So as Justin shared, separate and distinct from the Opioid Abatement Council, we are also working on how to best utilize the Spokane County opioid settlement funds that we've received through those litigations that Justin talked about beforehand. In doing that, our first step in that process was to create a public survey requesting public feedback on how residents of Spokane County feel as though that the opioid settlement funding should be utilized. In doing that, the survey was sent out and it was open from November 1st to December 4th of 2023. Within that time frame, we received 201 responses, which we were very excited about and very thankful for how thoughtful everyone was with their feedback in that. We had a 77% completion rate, which a lot of the questions were optional, so that's not really indicative of how successful we were in that. We were very successful with the responses that we got. Of those, we had a large percentage, about 105 of those responses were professionals that were working in the field, working with those that have been impacted by the opioid epidemic. With the second largest amount of people that completed the survey had family members that were impacted by the opioid epidemic. We also had business owners, Spokane County residents, as well as people with lived experience that also completed the survey, which was really important as we look to develop our priorities for the Spokane County funds. Within that survey also, we asked the community what they believe we should focus on in terms of the approved uses that are outlined in the One Washington MOU that states what we can and cannot use those funds for. The number one ranked priority was for supporting people in treatment, so supporting those who are struggling with opioid use, and that does not necessarily mean direct treatment. That is the second priority, but that is related to transportation and anything else individuals need to support them in their recovery. Number two, the second highest ranked priority was the treatment of opioid use disorder. So those are those clinical-based services, anything from outpatient treatment all the way to inpatient treatment. The third priority was connections to care. So making sure that people get connected to the services that they need was important to our community, as well as supporting individuals that are criminally justice involved. And as we look at this, you'll see that there's number 3 is actually listed as number 4. So this was a ranking question, and supporting people that are criminal justice involved was answered to be more of a priority, a higher priority than connections to care. However, connections to care had more responses, if that makes sense. And that's why this graph looks a little funny in that way. And then this next graph just shows that we had a wide range of folks throughout Spokane County complete the survey, which we were really excited about. Many of our zip codes were incorporated in that, and it was not just centric to just one zip code. So we had a wide range from many different zip codes throughout Spokane County. And this slide's probably a little bit difficult to see, but this is in the survey, we asked questions about what should the priorities be and garnish some narrative responses within that. And it represents the specific programs and needs or ideas that our community members thought were important to highlight within this survey for the use of opioid funds. We analyzed these responses and put them into a couple different categories. As you can see, the bigger the bubble, the more responses. So you'll see that includes substance use treatment, supporting pregnant parenting women and babies with neonatal abstinence syndrome, supportive housing, first responders, and therapeutic courts. And then again, there's this special call out section that kind of incorporates a very wide range of responses. Approximately 47% of the responses came in this special call out section, and that ranged anything from a specific program, the needs specific programs that did not fall into these other categories, transportation needs, the need for higher or increased wages for substance use professionals and those working within the field. There were also responses that some people thought that people struggling with opioid use disorder should just be incarcerated. So again, a very wide range of responses in this section, and that is why that bubble is so big. The next highest came with people mentioning the need for substance use treatment services. Some people mentioned that there is a high need for more detox facilities. There's a lot of people talked about expansion of the Spokane Regional Crisis Stabilization Center. And then other programs mentioned were compassion addiction treatment and the Rising Strong program. So all programs that go to direct treatment services for people struggling with opioid use disorder. And then the next highest little bubble there was support for pregnant and parenting women and babies with neonatal abstinence syndrome. Mentioned more often than not in this bubble was a program called Maddie's Place, which I know that we have talked with this group about before. They support babies with neonatal abstinence syndrome using non-pharmacological treatments, as well as their parents or caregivers, ensuring that they get the connections they need to remain in recovery and to keep the family unit together. And then the next highest was supported housing. This ranged from homeless services to sober living, like Oxford type housing, just an overall need for housing in our region specific to those people that are struggling with opioid use disorder. We also had a large portion of the comments related to therapeutic courts, the need to expand upon existing courts, as well as there was a couple times mentioned the need for a medication assisted treatment type court, which we do not currently have in Spokane County. And then last but not least, we had a lot of people respond saying that there's a need for support for our first responders. There was several programs mentioned. One of them was called the SPIRIT program, which is the Spokane Paramedic Intervention and Referral to Treatment program within this, as well as the Frontier Behavioral Health Co-Responder program. Just lots of support for first responders in terms of having a co-deploy team go out or additional supports and services to make sure that our first responders are safe and have access to the resources they need to be successful. So after the survey went out, we worked to collate the information and produce all the information that you just saw. From there, we also put together our Spokane County Priority Review Committee, which was made up of a couple members here today. Dr. Limburger, as well as Gail Koval, participated in our Priority Review Committee. It was a group of subject matter experts to help us collate the information from the survey, as well as share feedback on specific priorities that they saw was a need based on their experience. So a wide range from law enforcement to our Behavioral Health Advisory Board to advocacy groups, as well as internal experts from our department as well. And
I just want to do, Jessica, I just want to do a call out for Gail and Dr. Limburger and Under Sheriff Thompson. Very much appreciate your time and engagement to support us in this effort. Spokane County's, the input is not only valuable to Spokane County, which is where the input is going to be utilized to guide the commissioners, but also to all the municipalities in our region who consistently requested Spokane County's input. So all of the really wonderful information shared by the collection of BHAB members here has been brought forward as collection as part of the direction of the opiate use or opiate prevention mechanisms by which the dollars will be focused on. Commissioners have expressed their significant and dedicated exception for all of that work and time that the BHAB does, as well as for the members who participate their time to support us in the selection. So thank you. Thank you for your time and consistent willingness for every time I reach out and say, please, can you help us? We thank you.
Thank you, Justin. Huge shout out to those three. We really appreciate your time and expertise.
Jessica?
Yes.
Hi, could you go back to the previous slide?
Yes.
Where it has my name, I'm not the chair. I'm just a member.
Okay, I will make that change. Sorry about that.
Okay, thank you. That kind of caused me a little alarm there.
Don't worry, Gail. I was very clear with them. Gail is not the chair. She is just a lowly member of the BHAB.
That's right. Thank you. Thank you for that. support,
I'm messing with you, y'all. Yeah,
I know.
no, we'll make the correction. Thank you.
Little foreshadowing, I don't know.
Or maybe
meant
you
to
will be.
be.
Who knows?
Wonderful. So out of that priority review committee, there were 4 main themes that came out of that, all in line with the approved uses that are set forth in the One Washington MOU that we talked about today. The first priority that was talked about was support for first responders. It was noted that first responders are often the first on the scene when responding to an overdose, and that this is a key connection point for individuals experiencing challenges related to opioid use. The second priority that was identified was the expansion of Maddie's Place, which we have talked about before. As previously stated, this Maddie's Place offers prevention and early intervention, and this is the earliest intervention point in treating babies suffering from neonatal abstinence syndrome, as well as offering support and connection to their parents and caregivers. The third priority that was identified out of this group was the expansion of the Spokane County Regional Crisis Stabilization Center. The need for additional detox and withdrawal management services was identified as a community need that was including the need for community walk-ins, which is not something that facility currently offers. And then the last priority that was suggested was making Narcan more available in as many locations as possible. This included increasing the availability for first responders and community members to prevent opioid-related overdose. So some great priorities that were came up with that group. So as we prepared to present this information to the board, we wanted to narrow it down even further. So as you'll see, this next slide is some of the recommendations that we presented to our Board of County Commissioners last week, completely aligning with what was identified in our Spokane County Public Service Feedback Survey, as well as our Priority Review Committee. We went along with the recommendation to expand Maddie's Place, as well as creating a behavioral health co-responder program, which involves first responders partnering with mental health professionals or behavioral health professionals to respond to people struggling with opioid use disorder, as well as community education and the disbursement of naloxone or Narcan. So these are really the areas that we have tried to focus on and are continuing to brief the board and share this information with them as they have sole discretion on how those funds are utilized. We're just here to provide ideas and priorities. Does anybody have any questions? I know it was a lot to cover. I just saw it struck 3:25, so I just started talking a little faster to make sure we can get to our other agenda topics. I'm not sure if any of my team members have anything to add before I open it up for questions.
No, Jessica, thank you very much.
Wonderful.
Yeah, that was a great overview, actually. I think it was very concise and it got to the point of what we did discuss, and I'm glad you were able to present it to the commissioners. And so we'll move on.
Thank you very much. And thank you again for your participation in that. That's a huge part of how we came up with our recommendations. All right, hearing some silence, I'm going to turn it back over to you. And
Sounds good.
Kim, and to stop sharing my screen and let
Thank
you move
you.
on to the next topic.
All right, looks like next we have some administrative updates. Looks like Ashley, we have you for a couple of them to start with. So I'll turn it over to you.
Unmute myself there. Wonderful, thank you, Kim. And so the first one on the administrative updates, one that we haven't really update on for quite a while is the Recovery Navigator Program, RNP. If you recall, this came about from legislation back in 2021, the Blake Bill, or Senate Bill 5476, and creates a program that allows for RNP staff, individuals with lived experience in active recovery, to mentor other individuals in the community through their recovery and help with engagement, connection to services with low barrier services. We have that in all 6 counties through 4 different providers. We have Pioneer Human Services for Spokane, Adams County Integrated Healthcare Services for Adams, Northeast Washington Alliance Counseling Services for Ferry, Lincoln, and Stevens, and Ponderay County Counseling Services for Ponderay, all providing services in their community. And we've had a lot of success with the RMP program. Each provider continues to demonstrate and report increased program engagement and community referrals. Not too many changes this year coming with them. They do have some updated program standards that are being put out by the Healthcare Authority. So we're anticipating some changes with that. As they continue to do great work, we still recognize there's lots of barriers in our system of care. And so with that, we do have some additional RMP funds that we are able to put out to RMP providers. So at this point in time, we're having RMP providers submit plans to us on how they could utilize funds to enhance and support those RMP services. I'll pause there in case there's any questions. Not hearing any. So I will jump on to Mobile Response and Stabilization Services, MRSS. This was something that we previously discussed as well. This came about through the Healthcare Authority and a grant with SAMHSA. Spokane was one of 2 regions in our state to be selected for this system of care grant to stand up a MRSS team. And so the Mobile Response and Stabilization Services is a youth-based team. It's kind of an enhancement to one of our crisis enhancements that we already have, our Child, Youth, and Family team. And so they are able to engage in longer-term support and stabilization for youth and families. It's really an upstream intervention that is meant to be utilized as a family and youth-defined crisis, so not a professional indicating, what meets kind of crisis criteria, but whatever the crisis might be for a youth or family, to receive early intervention services, as well as being able to not only provide that crisis response aspect, but that stabilization services, and stay with that family for up to 8 weeks in the community, connecting them with appropriate resources, helping them create safety plans, and addressing kind of the precipitants to what might cause crisis, and help them prevent them from having to utilize emergency rooms or come involved with the criminal justice system. And our provider for MRSS is Frontier Behavioral Health, and they happy to report in December, they actually started providing services for this team. It took a while to kind of get all staffed up with workforce shortages that we're experiencing in our region, in our state. But they so far have a team comprised of 2 peers, 2 clinicians, 1 mental health professional, and they're still recruiting for a supervisor for that program. And they have just started receiving those referrals. And so I wanted to give that update as a resource for our community that is now being able to be utilized. Any questions on that, Guy?
Ashley, you may or may not know the answer to this, but I assume the referral stream for that is still essentially regional crisis line for CYF referral, and then they within that system sort out where that goes essentially. Is that correct?
Yeah, and I think they're still kind of getting that process down, but my understanding is that yes, Child, Youth, and Family can be a direct referral into that because they are engaging more on that crisis, initial crisis response. But someone could also call the regional crisis line or 988 and ask for services for stabilization services. And I think they would kind of triage and make that determination if that falls under that realm as well.
Got it. Thank you.
All right. No other questions. I will just say real quick about the next topic. I know we have Stephanie Sorensen, our REACH program manager for the next one. She unfortunately had to leave early today. So we have Mr. Josh Henderson speaking on behalf of the REACH program.
Wonderful. Thanks, Ashley. Yeah, Good afternoon, everyone. I'm Josh Henderson. I am a child and adolescent program administrator here at the Spokane County BHASO, and pleased to provide you an update on the REACH program today. I think it was the summer of 2023, maybe a little before July, I provided an update on this program. More generally speaking, it's the Youth Behavioral Health Navigator program, which is a statewide program implemented in various regions throughout the state, ours being obviously here locally, our regional service area. And we have decided to call this program REACH for us, which stands for Resource Engagement for Adolescents and Children. And just wanted to kind of provide an update on where we're at with the implementation of that program. We received that contract July 1st from the Healthcare Authority. So we've really done a lot of work to help get this program along and out into the community. And Stephanie has put in a ton of effort and time in making sure the partnerships that have been included in this are quite robust and have made it just really effective already. So for those who don't know, REACH is really a multifaceted program. It can kind of be thought of as a resource hub for youth and families. One aspect of REACH is we have a steering committee panel made up of about 40 to 50 members from a variety of different agencies in the community. That could be mental health agencies, that could be more educational support programs like schools. It could mean Boys and Girls Club. I think they serve on our steering committee as well too, but a really robust youth serving network that comes together to look at how we really want to implement this program in our region. So as many of you are aware, in our regional service area, we oversee 6 counties. At this point, the REACH program is just, as we're kind of doing a soft launch here, starting with Spokane County at this point in time. And the priority population is youth presenting with complex behavioral health needs that are being kind of what the term is boarded in emergency department settings. So it's oftentimes maybe families are not aware of the resources, or that's just kind of a safe place that families feel they can take a youth that's struggling, but really maybe isn't meeting their needs fully. And so that's the priority population of REACH, is how to address getting youth out of those inpatient hospital settings where they don't really meet that level of care as far as mental health needs goes, and then out in the community and providing them support. And then kind of the secondary priority population would just be any youth with complex behavioral health needs, looking at additional resources. So with the program, our steering committee comes together and we meet monthly. At this point in time, we've had 2 steering committees. And during those meetings, at this point, we've addressed things like, what do we want our mission to be of the program, our values. We've developed a charter to kind of outline how we're going to address things and just what are the roles and responsibilities of steering committee members. And then also developing action items. What are some things as a steering committee that we want to look at within our community that we see needs, and how can this program specifically meet those needs? And so we did a poll. Stephanie created a poll with our steering committee members to kind of determine where the focus of the program. And that's what's been great, is this program, although we are the contract holder, it has been so beneficial to be partnered with so many wonderful agencies and people that have participated and helped really launch this program, launch it quickly and effectively. And so during one of those steering committee meetings, some of the priority action items were improving access to care. That was number 1. Access to youth substance use disorder services, caregiver respite, and prevention and early intervention resources. So that's really the action items that we want to look at over the next year, and how we can come together to implement those changes within the community and partnering with other existing resources to do so. So that's kind of one aspect of the REACH model. The other aspect is how youth and families can access this. So it's not only addressing needs within the community and being a resource hub, it's really families can request meetings to meet, to bring cases of youth before. Let's say they're struggling with behavioral health needs and they're not sure of what resources exist and really looking for additional help, or it could be providers asking for referrals and making referrals to the REACH program. And those are what we're calling our MST meetings, or multi-system team meetings. And those are going to be different than our steering committee. Some of the same members that serve on our steering committee have also agreed to be on our MST committees, but it doesn't have to be the same folks. We have a variety of people serving on our MST meetings as well. And at this point, the plan is to, in the near future, accept referrals throughout the community, but we're starting with specifically emergency departments here in Spokane County. And so we hope to do that and take our first referral here in the next couple of weeks, or maybe early into February, We do have a specific referral form for providers that they can fill out that we've tried to streamline, that we've gotten feedback from our steering committee members on as well, of what would be helpful if you're an emergency department making a referral to the REACH program. And so we're really excited to be launching that and addressing that priority population. And then here in the near future, we'll continue to provide updates on when any providers in the community can make referrals to the program. Again, I think I mentioned that Spokane County specific, but the plan would be in the future, we would continue to have this program be implemented out into our frontier rural counties as well. We are in the process of hiring a case manager as well to support Stephanie. Stephanie has pretty much been rocking and rolling with everything here, so I think she's going to be super thankful when we get that up and going. So again, that's a super brief update on the program, but there has been a lot of change since we last talked about it. I know we're really excited about it. It's been a privilege to partner with Stephanie on this program, but I'll kind of leave some time here for questions because I know that was a lot of information.
Josh, this is Kim. I don't know if this is an answerable question, but the phrase complex behavioral health needs is relatively vague, and I get that that's somewhat, I imagine some of that is intentional, but do you have a little bit more, keeping in mind, I think that can catch a lot of stuff, but when you guys came up with that particular phrasing, can you maybe give examples or some just a little more insight into what you mean by that?
Yeah, great question. That's more of a term that is part of our contract with the Healthcare Authority. When we're looking at priority population, they've identified complex behavioral health needs. That is a vague term, and I think in part because it might look differently depending on the needs of the youth or the community that they're in. If those resources are few and far between, then we might be having a meeting for a youth that maybe in Spokane, they would be able to access more services and maybe wouldn't be having that conversation. So I think in one sense, there's ability to have it more vague. When I think of how we want REACH to be addressing complex behavioral health needs within youth, we're really looking at, I think, often youth who maybe are involved in multiple systems of care. So DCYF, juvenile, maybe they've had multiple hospitalizations. And I think what we're really looking at is youth who are primarily being brought to the emergency departments. So if it's a youth needing more intensive inpatient level of care, then REACH isn't primarily focused on that because our goal is to get youth out of the hospital who are in inappropriate settings for treatment. So I hope that answers a little bit. I think when we think of complex behavioral health needs, it's youth that are involved in multiple systems of care and maybe their current symptoms or presentation are just not being met by the resources that are currently being provided to them. So it could be that complex behavioral health kind of presentation might look different from one family to the next. And so we kind of also go based on what families are going to say as well. They might make referrals to the REACH program and they're not aware of what resources exist. And so there's probably going to be a varying degree on what complex behavioral health means, but we're really focusing on that priority population of emergency department settings. I hope that kind of answers your question, Kim.
No, that helps. Thank you.
Yeah. Gail.
Yes, thank you. My question is for if we're making and with the focus of emergency rooms at this point in time, I'm thinking about Spokane County itself. There's three community hospitals, not discounting, of course, the psychiatric hospital that's downtown. So is there a form that the ED docs will be using or the referents will be using? I'm just curious about how that's going, the education of this available resource.
Yeah, great question, Gail. Stephanie has reached out to those hospital emergency departments and social work teams to meet with them independently on the program and kind of just prepare them on what the program does, how to make a referral. And we have actually, in our first steering committee, kind of brought forth a rough draft on a referral form that a provider would use. And we got a lot of really great feedback. We had Dr. Phelps-Chang on that call, the psychiatrist from the BEST program at Sacred Heart, and then just other individuals on there that were really thinking that if emergency department is going to be providing this referral, how can we streamline it? So we actually have just a 2-page referral form that those hospitals can fill out and send to us. And then we would have a little bit different provider form for families to get additional information and things like that. So we have met with those hospitals. Stephanie in particular has done that, provided education on it, what it looks like, and then developed our referral forms to meet the needs of kind of ensuring that we're being mindful that when we're asking for referrals from emergency departments, that it's not too onerous, but at the same time that we have enough information that we know why we're getting the referral. So that's been a privilege to be a part of that community feedback and trying to streamline what we want this to look like.
Yeah, we certainly want it user-friendly to where you can get kiddos in the right place, get them hooked up with the right stuff.
Exactly. Yeah.
Josh, remind me, are you the contact for CLIP as well in the county?
I am. Yep.
Okay.
I am.
So just to be clear, these are not kind of going back to your kids with complex behavioral health needs. We're not necessarily talking children or adolescents who are necessarily, I'm trying to get a sense of, you don't want to get a lot of kids who are being referred to CLIP for this, right? That really is going to be a separate process, or could you talk a little bit about that?
Yes, I can, Kim. I was asking those same questions when we first learned about this program of how are we going to make sure that this looks different, is looking at kind of a different population here. So that is a fantastic question. So our CLIP task force, for those who are aware, and I know that this is not an agenda topic, but that's going to serve youth who are specifically looking at more intensive inpatient level of care and have exhausted community behavioral health resources, including lower levels of inpatient mental health care, and are needing that higher level of care. It may be that in a REACH meeting where we have an MST, we may find out a little more information and say, gosh, this youth is really struggling, and yes, we're going to make additional recommendations about pursuing this resource or providing help within the school setting, but it's primarily not going to be, it does not have the ability to make a referral to CLIP, but it does have the ability to make a recommendation that if a youth might need that level of care, then to refer that youth to our task force. But we do want to where CLIP is addressed, but we do want to make sure that we are having youth kind of directed to the appropriate resource. I would say with REACH, we're trying to get them and keep them out of the hospital per se. And we're always looking at that with our CLIP task force as well. But we're often looking at really higher levels of inpatient care. So REACH could refer to our task force. Like I said, if we find out that a youth is needing much more intensive mental health support, and that would be the best, but REACH can't make the formal recommendation for CLIP. Our CLIP task force has to do that. So, but again, we also want to balance not asking families to go through multiple committees and having to go through this whole process. We do want to try to streamline that up front. So that's probably going to be a conversation too that Stephanie and myself might have, and be able to collaborate on which resource would be best, as well as talking with the providers on that.
Got it. Thank you.
Any other questions? Fantastic questions, by the way. This is great. I think you guys are definitely asking good questions about how this might look different, because that's what we don't want to do, is just duplicate services that already exist.
So Josh, this is Gail again, and my camera is not working. I can't figure out why, but that's okay. So, for example, if a parent and we're in somewhat of their own crisis, and this happens with me periodically, when parents will call and they have a kid that's down there at, in the ER or ED department, and they are at their wits' end. They want to get them discharged. It's just not gonna. That's just not a good thing. Could I refer them to the ED doctor to see if they would fit with this program, or how would that work when I get contacted by parents?
Yeah, I think if you have a youth that's in that emergency department setting currently, family calls you, I think, yeah, you can definitely share. Are you familiar about this resource? The referral would have to come from the hospital. So we would want that. But yeah, if that can be a conduit where at least it's being broached with the emergency department. But again, we would want the focus coming from the emergency department at this time. We're really wanting to make sure we focus on that before we fully implement providers being able to make those referrals. But I could see that as definitely a potential option. And I think a lot of times too, it could be that when the time comes when it's open to all providers and families in the community reaching out, it may mean that it's just a phone call with Stephanie or the case manager when we hired that position of just looking at resources and kind of helping direct that path. I don't think every conversation might result in an MST meeting, but just knowing that some might, especially if the youth is in the emergency department and we can pull everyone together to meet, then yeah, that'd be a good option. But yeah, I think at this point we would want to have those referrals coming specifically from the ED. But I know, Gail, you're in a unique role where families feel like they're kind of lost, and maybe broaching that with the emergency department, if family can do that, would be a good option. I don't know, Ashley, if you have different thoughts on what you envision in that scenario, but.
No, I think that was a great explanation. Josh, I think definitely, our priority population is, like Josh indicated, those in the ER. And I think if a family member is reaching out about a youth that's in the ER, I still think that could be a phone call with our program manager, Stephanie, to discuss, and maybe her even assisting and reaching out to the hospital with the family or youth's permission to kind of get that initiated or started if there's any confusion about how that connection can take place or what that is and what needs to be done to get that accomplished. Kind of going back to that referral process, there is a referral form, but I think we completely recognize that with the REACH program, there's the ability to kind of walk people through that referral process and help them access the things that we might need to get that moving and get that moving forward.
Thanks. It's Gail again. In particular, there was a mom who called me earlier this year, and you could hear the stress and emotion in her voice with not knowing what to do for her 13-year-old kiddo who also had some, reportedly some pretty aggressive tendencies, and was worried about the younger children in the home. And so it would have been this, I think, in the future, if this has become more known, that maybe this could be an avenue that, we could refer like parents like that to.
Yeah, and I think too, Gail, part of getting this out there is one of the important parts of the program is we'll have our own website as well. So folks are going to be able to access that information there, and we want to keep a newsletter that we send out. So there's going to be definitely a lot of just information and getting the word out. We know that will take some time, but we recognize the importance that we want to have a space where families can easily access that information. And then be able to navigate resources as well, that we would have kind of an active resource list that we would keep updated on our website. So if families were interested in looking at mental health resources or substance use resources, they could actually easily navigate that from our own REACH website.
Great.
Folks, any other questions for Josh?
Wonderful. And I can put, sorry, Kim, I didn't mean to jump in there. I can
No,
put
it's okay.
Stephanie's contact information and mine in the chat as well. So if folks want to reach out again, she'll definitely be the primary point there. But I will put the information in there as well. So if folks are interested, I know I think there was a couple folks from here that are part of our steering committee when I presented last time that had reached out. So if you're interested in that or on our MST, let us know. Be more than happy to have that conversation, but I'll be sure to put that in the chat.
Okay, sounds good. Okay, moving on. Let's see, next on the agenda, we have the election of chair and vice chair. So I'll just say who is interested. I have certainly no problems continuing, but I would like to share the opportunity. I think I've been chair this time for the last 2 years, I believe. And then I think immediately prior to me was Dr. Limburger, who was chair for at least a couple of years, if not longer. And that by no means means that Dr. Limburger could not desire to chair the committee again, but at least for me, I'd like to have an opportunity for other folks to take over. It is unfortunate that our vice chair today, Andrew, is not here to kind of express what he would like to do, but I'd like to open it up to folks to have a discussion. Certainly toss your name in if you would like to be considered. Have I lost my hearing or am I not hearing anyone speak up?
Okay,
No, I
this
think
is
you're doing a
Gail.
wonderful job, Kim.
Yes,
I
Thank
think
you.
I think you're on for another couple of years.
Gail, were
I
you saying
agree.
something too?
I was just going to say, I'm really happy with your leadership of how this has been run. And I would vote to continue you in as capacity of chair. Unless somebody else expresses an interest.
I
No, I think
appreciate
we
that.
should
Thank
just
you.
Second that nomination.
Oh, thank you, Shane. I just want to add that I would like to, again, in Andrew's absence, I would like him to have an opportunity to speak about whether or not he'd like to become chair. I guess I'll also point out that Shane, you did say something about you may only be on for another year. So I want to open up the possibility of you taking on one of the leadership positions as well.
No, I've just signed on for another 3 years, Kim, but if you're in a position where you don't have an under chair, I would help out with it, but I think Andrew is going to do it. But
Okay.
let me know.
Okay. I would like to do this and then Justin, tell me if we could do this. I would like to have a conversation with Andrew about whether or not he would like to take on the chairship for this year. I will try to get to contact with him in the next couple of days if I could get contact information from someone at the county. I don't want to defer this necessarily out for 2 months, but could this be something that's decided over the next few days in the interim? And then communicated by email?
Hey, Kim,
Yeah,
I don't see Justin still on here.
okay. Nancy, do you have a sense of that? Are you still on?
Yes, I'm still on, Kim, and we certainly can do that. We can, if you want to reach out to Andrew and then notify Crystal and I, then what
Okay.
we can do is we can then propose to the board. Just know that to expect a message to the board within the next few days this week to see if we can then finalize the vote.
Okay, that sounds good. And then if we could do a vote by mail?
Yes, we'll do
Okay.
it that way, because I understand the position of wanting to give Andrew the ability to
Okay.
voice.
Okay, perfect. Okay. I will reach out then. So let's do this. I will reach out to someone at the county regarding Andrew's contact information. I will do that tomorrow, or actually this afternoon or tomorrow. I will make an effort to get hold of him, have a discussion with him, and then get back to county folks this week so we can finalize. So is that agreeable to everyone?
Excellent.
Yeah,
Yes.
sure.
Definitely.
Okay. Just to be official, could I get a motion and a second on that?
Your motion.
Second.
I'm
Okay, sounds good. All in favor?
Aye.
Aye.
Okay, perfect. Okay. Looking at the next agenda item, it looks like, Tom, we have you for a report from Consumer Consultation Panel.
Yeah, I have here my consumer consultation panel minutes from September, October, November, and December. First, I'll do September. At this meeting, our guests were Gail Cole with the Office of Behavioral Health Advocacy and Kaylin Roy, a liaison to the BHASO and CCP. Brent Smith, CCP Chair, facilitated the meeting. Also attending were CCP members Tom Goltz, Aaron Smith, Robin Segner, Sarah Leak, and Sophia Alexander. The online September 2023 CCP meeting was called to order. The August CCP meeting minutes were read and approved. There was no August Behavioral Health Advisory Board meeting, so this was not reported on. We discussed the coming Santa Pictures event the CC plans to do. We decided to do the event at Brent's apartment complex on December 2nd and do the event at the Quality Inn on December 9th. It was suggested we get out the flyers for the event by September, October. Sarah wanted to know if the CCB could get money returned that we used for the Evergreen Club 5K. This event was canceled due to poor air quality from fires in the area. It was noted that if we get our money back, we will still have a budget of $109.38. Brent suggested we leave the funding for the Santa picture event at $58. Brent said that he's working on getting a new printer for the pictures, which his son says works very well. Brent also said that he now has CCP applications if anyone knows possible new members. Gail said that at the October CCP meeting, she will give an update of the OBHA. This is the OBHA's 1-year anniversary. Robin reported on the CC Book Facebook page. She said that there are no new updates. Brent said that the page looks great. Robin also said that she posted about the passing of Jeff Thomas and that she will post about the Santa picture when it gets near time to do so. Gail said that she will send out a survey about the mental health advanced director for the CCP to fill out. The next CCP meeting will be held online on Monday, October 9th, 2023 from noon to 1 p.m. Meeting was adjourned. Here are my minutes from October. At this meeting, our guest was Kaylin Roy, liaison BHASO and CCEP. Brent Smith, CCP chair, facilitated the meeting. Also attending were CCP members Tom Gold, Aaron Smith, Robin Segner, Sarah Leake, and Sophia Alexander. Gail Colgan was absent. The online 2023 CCP meeting was called to order. In September 2020, CCP minutes were read and approved. We discussed the September Behavioral Health Advisory Board meeting. At this meeting, there was a presentation about the 9/8 and Spokane Regional Emergency Communication, SREC, by 988 Program Director Sarah Schumacher and 988 Program Administrator Amy Robinson. When 988 is called, the responders ask for name, phone number, address, counselor, and families, etc. of the caller. The service is valuable to everybody. 24 is available to everybody 24/7. Just dial 988. The regional crisis line is 1-877-266-1818. The refer one to call the 988 line if a person is suicidal. There is a certain amount of anonymity to the call. There was then an administrative update. Jessica Johnson reported on the new program. She mentioned that the Youth Inpatient Navigator Program. This program is putting together a team for youth and families who experience trauma and problems. They are hiring a team leader. The program is partnered with NAMI to fund the Behavioral Health Navigator Program. The program also provides a transitional support pilot program, provides outpatient services for people in poverty, for people going from transitional housing to supportive housing. Jessica also mentioned that there's a continuous expansion of the service for the Institute for Student Wellness, ISW. Justin Johnson reported on the Spokane opioid funds. He said that the first set of funds have been concluded. He said that Spokane County has yet to create an OAC and run an OAC opioid abatement council. However, when created, the OAC will oversee how to use opioid funding. It was noted that Spokane County has been approved to be the OAC. There was a crisis data dashboard update by Jessica Thompson. She reported that there have been 308 high utilizer, 11,714 regional crisis hotline calls, 4,778 served, and 17,165 total service provided. Gail Colgan reported that there is going to be a discussion about the 988 line at the October OBHA forum meeting, and that there was a 988 emblem for license plates. Jeff Thomas, the CEO of Behavioral Health, who passed away recently, was then recognized. We discussed the coming Santa picture event that CC plans to do. We plan to have flyers ready by October. There is a $5 suggested donation for each picture. We suggest that we do the pictures. When we do the pictures, we have flyers for the CCP Jaunt in June event to pass out. It was mentioned that people getting the pictures may have cats or dogs. Brent said that his son has a printer and that Brent will buy the ink for the ink. It was noted that we will need frames, photo paper, cocoa, coffee, and candy. We also may need suspenders and a pillow for the Santa outfit, possibly drop pictures. After we receive the refund from the Evergreen Club 5K, we should have $109.38. We need to use all of this as it will not roll over next year. Also, Kalen said that he will see if he can get the CC budget increased next year. We intend to do the pictures on December 2nd at Brent's apartment complex, the Fay West. Only people from Fay West and Fay Gardens can get to have their pictures at this event. We also intend to do the picture at the Quality Inn on December 9th. This event is open to the public, I believe. It was mentioned that a memorial for Jeff Thomas will be held at Evergreen Club on Wednesday, October 11th, 2023 at around 1:45 p.m. The next CCP meeting will be held online on Monday, November 13th, 2023 from noon to 1 p.m. Meeting was adjourned. Here are my minutes from November. At this meeting, our guest was Carol Riley, Integrated Coordinator with Spokane ASO. Brent Smith, CCB Chair, facilitated the meeting. Also attending were CCB members Tom Gold, Aaron Smith, Robin Stegner, Sarah Leake, and Sophia Alexander. Kaylin Royal and Gail Kogel had excused absences. The online November 2020 CCB meeting was called to order. The October 2023 CCB minutes were read and approved. There was no October Behavioral Health Advisory Board meeting, so this was not reported on. Tom Goldston said that they will not be able to attend the November Behavioral Health Advisory Board meeting because of a doctor's appointment. They were wondering if Gail can take a few notes at that meeting in order to inform the CCP as to what happened. We discussed the coming Santa Picture event the CCP plans to do. We intend to do the pictures at the Fay West Apartment Complex on December 2nd from noon to 4 p.m. We should arrive by 11 a.m. We decided to have the CCB Christmas party at this time also. The CCB has scheduled another Santa Picture event, Equality on December 9th from noon to noon to 4 p.m. We should arrive at this event by 11 a.m. also. A purchase order of items for the event has been requested. The items will be shipped to the Department of Community Services. There is a suggested donation of $5 for each picture. There will be could be $40 left over after purchase. The items in purchase of the items for the events. A possible use for this could be to buy a universal connector for the computer we are using at the Santa events. Brent then said that he posted flyers advertising the event at local college, and Sophia said that she will post flyers at Evergreen Club. Robin said that she will advertise for the event on the CCB book Facebook page. It was noted that the proposal for raising the CC budget in 2024 has been submitted. Note that the next CCP meeting will be held online on Monday, December 4th from noon to 1 p.m. A week earlier than usual. Meeting was adjourned. We hear my minutes from December. At this meeting, our guests were Carol Riley, Integrated Coordinator with Spokane ASO, Gail Cole with Office of Behavioral Advocacy, and Kaylin Roy, liaison between the BHASO and CCP. Brent Smith, CCP Chair, facilitated the meeting. Also attending were CCP members Tom Gold, Aaron Smith, Robin Stegner, Sarah Leake, and Sophia Alexander. The online December 2023 CCP meeting was called to order. The November 2023 CCP meeting minutes were read and approved. Gail reported on the November Behavioral Health Advisory Board meeting. Gail said that this meeting, Robert Langham NAMI explained what he does. He said that he receives emails and gives needed information. He meets with family members and facilitates groups. He sends a lot of people to the RISE program. Gail also that Ashley McGee mentioned that surveys are open about opioid funding. There were legislative updates at this meeting also. It was noted that at Maddie's Place, funding is increased for infants with alcohol or drug problems. It was noted that crisis provider funding has increased. At the end of the meeting, the participants were asked if they would like to do the meeting later on in the day. It was mentioned that the Behavioral Health Advisory Board bylaws may be changed to just Community Services Department. The CCP has noted that Anagogan Hall, Hope House, the Union Gospel Mission have services for women. The CCB did a follow-up on the Santa event. The CCP made maybe $5 or $10 at the event on the Fay West Apartments on December 2nd. $5 is suggested donation. The CCP was planning to do an event of Quality Inn on December 9th. They advertised for this event at the Northtown Mall. However, the roof caved in the Quality Inn, so both the event and the advertising for it had to be canceled. Robin then suggested that we use the $40 left over from the budget to give to Sophia for some candy she bought for the Evergreen Club 5K. Robin also said that when the time is right, she will put information about the John and June or walking event that CC does on the CC Book Facebook page. Also, it was mentioned that we want to know want to know the CC budget will increase next year. This is under consideration. Our next meeting will be held online on Monday, January 8th, 2024 from noon to 1 p.m. Meeting was adjourned. Those are my notes.
Thank you, Tom. Yeah,
Okay.
any questions for Tom?
I think
Tom?
Craig wants to do something.
Yeah, Craig, go
Wait.
ahead.
Yeah, I just have a letter to read, a short letter about group home safety and the bullying that goes on in some of the group homes. I'll just read it. It's a few paragraphs. First, the safety of group homes is highly questionable and demands major reforms in bullying and resident safety. I researched the laws passed by the Washington legislature in 2002 at Gonzaga Law Library and gave a presentation on anti-bullying policy and procedures to the board back in 2004. I've been bullied several times at the group homes of Milford House and Blair House. The present manager does not effectively deal with the bullying problem. And I'll add there are some other people being bullied too, not just me. I was bullied by Stephen Lloyd at Milford House for a total of 6 months, and nothing was done to confront Lloyd and rectify the problem. Instead, I moved out to the independent living where Tom Ghost lives here in April 2017. Needless to say, Lloyd did commit aggravated assault on a younger man, Luke, whose eye bones and cheekbones were crushing, requiring the young man to be hospitalized, and we never saw him again. Lloyd was arrested and charged with aggravated criminal assault, was finally kicked out of Milford House. Second, I had an incident at the independent living house where Mason Hollenbach pulled out a foot-long knife, told me he had a very bad temper and not to piss him off. And he told me he had stabbed a girl in school for which he got kicked out of school. That was high school. 3 red flags. I told the staff at Blair and they confiscated the knife. He should have, and the point is he should have never been in possession of a knife to his criminal past. Finally, I had 2 very dear friends, my girlfriend Leanne Hellman, my friend Randy Kramer, kill themselves due to abuses by the mental health system. Leanne struggled with depression and schizophrenia, but had earned a BA in piano and voice from EW in 1980 and was placed in Malin Place, Mother's Day 1995. She continually got worse and overdosed July 1995. She was 943. Randy had a degree from Georgetown University in 73 or 74 and had a BA from Eastern Washington University. His case was closed due to resentments, not on the part of Spokane Mental Health. He killed himself September 19th, 2005. He was 54. This begs the question: better oversight and a metanoia on the part of mental health in Spokane, Washington. The manager here just doesn't deal. I've been bullied. There's 2 people here next door at Blair House that they're bullying me, but it's settled down a little bit. But the manager doesn't deal with bullying. He just now the manager in way back in 1988, Rhonda Jones dealt with bullying right away. If someone bullied someone, she did kick one man out. Steve Castler, who was bullying people right and left. And then I tracked him. He did go to 4 different group homes and he was kicked out of all 4. He died in 2020 in what I don't know how old he was, maybe 70s, 80s. He was just a mean old guy. And you can't use mental illness as an excuse to bully people. You've got to act civilly. The mentally ill just have to act civilly to each other. That's just a responsibility. That's just a basic premise of being human, having some civility to you. But I just think the group homes, at least Blair and Milford, it's better at Milford now. It's way better at Milford. I go over there, I have friends there. They say it's way better there now at Milford than it is here at Blair. They've heard bad things about Blair. But that's all I just have to say, that there has to be major reforms in safety, taking away safety for the residents and bullying. Thank you.
Thank you, Craig. Folks, any comments for Craig or Tom? Questions regarding CCP at all?
This is Gail. Craig, I just wanted to mention that another place that you could voice your concerns about bullying would be to the local long-term care agency, because they are the ones that oversee the group homes where you live. Maybe they could implement some kind of action on your behalf. I'm not sure. That is just a thought.
Okay. Thanks, Gail. Thank you.
Tom, I do have a question. Do you have a flyer brochure? I know you mentioned the Facebook page a couple of times, but do you have any like a written documentation or a written resource about the consumer consultation panel?
Well, we have a consumer consultation Facebook page. It has information on the John, June, and Santa picture events. That's all I know about.
Okay. The reason I'm asking, I would like to be able to, and you can do this or not, but if you would be able to put together, it doesn't have to be a brochure or flyer, but even just sort of a short description of the consumer consultation panel folks that you're looking for, that you would like to join, kind of when you meet, like regular meeting schedule. And if you could pass that along to me, that would be great. I would like to give more folks information on your group.
So this is for folks who might want to join.
Correct. Yes.
Okay, a short description.
Yes, that would be great if you would.
I'll try
Thank
to
you.
get that going. I'll try to ask other members about that too, I guess.
Okay, that sounds good. Just let me know. Thank you very much. All right, folks, moving along. Any board comments?
I have one.
Yeah.
So, right now, well, it's going to be in Ways and Means Committee tomorrow at 4 o'clock, but Senate Bill 5660 is hopefully going to go through this year. It has to do with forming some work groups who can help to mainstream a mental health advance directive so that there are more people who know about them, can take advantage of them, and facilities that understand what they are and how they can be used. The other part of that is developing a repository once are filled. So once are notarized and in place, and it's really important work. So if you go to Senate Bill 5660, there's some documentation there. But if you really feel, I would look for people who would register as pro for this bill, so that we can get moving forward in mainstream mental health advance directives.
Okay, that would be great. I think I mentioned, I don't know, it might have been a year ago at this time, maybe time flies, but I would personally like to do kind of more work in the area of mental health advance directives for this area. And I know, Gail, you expressed interest in assisting with that. And there was at least 1 or 2 other folks on the board who did too. And I will just take responsibility for the fact that I have not done much on that, to be honest, in the last year or so. But I would like to pick that up again. So if you're interested, please let me know. We'll kind of go from there.
Yes, I am interested still. I hope others are too.
Thank you. Any comments from members of the public who may be here? Okay. Well, folks, I think that is it for today. I appreciate your coming. Let's go ahead, and if I could have a motion to adjourn, that would be great.
Motion to adjourn.
Second?
Second.
I'll second.
Perfect. Great. Thank you very much. Have a good rest of the afternoon, folks. Take care, and we'll see you again Monday, March 25th.
Bye. Thank you.
Bye-bye. Thank you.